country has ever faced. It would have been an easier fight if only we did not plunder public resources. If only we did not overlook issues raised by workers in various sectors. If only we had more politicians who were more people-focused and not as egocentric. If only we had a stronger moral fabric when it comes to impunity in the small things. If only. Well, we look at the if-onlys closely in different facets of the Kenyan context. First off, we have our health reporter, Eunice Omolo. Now, Eunice, you've been covering health for a while now, and you have some grasp of the issues at play.
Yes, Imriti, over the years we have seen and reported of various concerns in the health sector. Some have been resolved, while others, significant ones at that, are still in bad health. Take a look.
The healthcare system in the country has been ailing for long. The journey to healing has unexpectedly made some strides on account of COVID-19 pandemic, much as the disease has hit the very system. A number of systemic and structural issues have exposed the entanglement of issues in the loose hem of the system's fabric. Shortage of medics remains one of the biggest battles between the government and the medical professionals, which has led to numerous strikes over the years. Now, COVID-19 has troubled the already stormy waters.
The dynamics are such that the human resources for health needed is sort of very high, and this needs to be put in now. Otherwise, you will get people getting COVID, then now there is no doctor to see the people who are coming, and it becomes a negative effect to the community.
Now they face the grim threat and reality of contracting the coronavirus disease while on duty. Before the pandemic, a number of hospitals and healthcare workers had raised concern of a lack of protective gear while at work, such as gloves. The reality of the risk is made concrete by COVID-19 related deaths of 4 healthcare workers and the infection of 450 of them.
When health workers are at risk, we are all at risk. It is therefore a public health priority for us to understand the risk factors for this vulnerable group to avert further occupational transmission.
And implementation of some collective bargain agreements could work against the country's war with the disease. A number of these blamed on the development of health.
The problem that has always been there has been non-payment of salaries on time. Almost 80%, 85% of counties in Kenya have not paid June salary.
Corruption, including the misappropriation of funds in the Ministry of Health, affected the proper allocation of funding to equip public health facilities with the right infrastructure prior to the pandemic.
The issue of corruption, the CS will say cartels in Afya House. But I'll tell him if he doesn't crack the cartels, he will become part of the cartels. Because you cannot transfer a cartel. A cartel must be removed and must be sent to jail.
As it is, county governments have been in a race against time to salvage the already spewing burden in the counties.
Last week, there are a number of counties that they indicated that they don't have ventilators, they don't have ICU beds.
The way of doing this is to have a health service commission, which already projects the needs of human resources for this particular population for up to 2020, and continuously employ trades. When some retire, then you replace. You see, without a fixed kind of system like that, then it becomes very difficult to rationalize.
Without a health service commission, healthcare system in Kenya is going to completely collapse. It's in ICU, but very soon oxygen will run out, and healthcare is completely going to collapse. Staff shortage, well, county governments have tried.
Had many of these issues been addressed adequately when they were meant to have been, then the country will be paces ahead in the journey of beating the coronavirus disease.
A lot of lessons to learn from the healthcare experience. And speaking of lessons, Leila Mohammed has been looking at what appears to be Professor George Magoha's toughest examination.
Precisely, Eunice, this is the toughest, if not one of the toughest tests for a tough-talking professor. And tonight it is not only George Magoha's answers that are being sought by Kenyans, but the government at large and everyone in the education sector. This is because there have been some underlying factors that are now growing into a mound of underbelly factors that the sector needs to grapple with. Take a look.
There shall be no KCPE for the year 2020. The school calendar of this year will be considered lost due to COVID-19.
With that declaration, the professor deemed the hopes of hundreds of thousands of candidates who had expected to sit the exams later in the year. As this reality sets in for the learners, the motivation of teachers comes to play as well. And it is made a marketplace as some of the issues are long-standing baggage from the past.
The problem is philosophical because we have insisted so much on the rules and the syllabus and the equipment, and we have not seen our teachers as the main resource for education.
The COVID-19 is a blessing in disguise because it has opened a gap that we had not anticipated to see. And therefore, it is now an opportunity for government to proactively engage all stakeholders and have a conversation over very serious matters like infrastructure in schools.
If we could have achieved social distancing, we would have opened schools. But we can't achieve social distancing. That's why we are delaying for the disease to stabilize among us so that it's not as lethal. And so it is not about infrastructure.
One of the main challenges is that of infrastructure, especially in light of the social and physical distancing concerns and demands.
This period that we now have between July and January should be a period which is supposed to be used to help develop the infrastructure in schools, look at the teacher issue.
4, 5. Many are the times schools in wanting conditions have been highlighted, but critics hold that the corresponding reaction has not been matching the needs despite there being resources available. Now with the pandemic dynamic, it becomes an even tougher situation, and more so because the government says it will not bargain on some issues.
Those that do not comply, we are not going to gamble with the health of our children. If we tell you what you must do and you don't do, then you shall not open.
The tough, long-standing dynamics of bridging the gap between the haves and the have-nots is also a drag to recovery process, but now it will take years for some changes to be achieved.
Could meet the demands of the emergent situation has been a real challenge, and the people who have had the brunt of this are mainly the disadvantaged family.
The fact remains that some people are already ahead. So I think that remedy cannot be done now. It has to be done at the end of the system. Involve, seek the opinion of teachers in the field and the communities. Work with them about a way to reopen the schools. This thing cannot be decided from Nairobi.
The government has 6 months to nurse the concerns while looking at how to inject life into the future of education before it ends up at the ICU. So schools are in a tight spot. COVID pandemic has revealed a very soft underbelly that government needs to look into as seriously as possible. Some of the education experts are now saying that education needs to be devolved just like its sister in the health sector. So for now, we take a little break. When we come back on the next side of this break, Smriti will be giving you much more with the team on this week's team coverage, where we're looking at how different sectors have been affected by COVID-19 and what needs to go on.
Now, historically, Kenya's politicians have been on the receiving end of criticism that they're all about themselves, that they will ride on your misfortune to better their own fortunes. Well, it appears that in the pandemic, some are staying true to this definition.
They sometimes move in large numbers, their guzzlers creating an aura of grandiose as they attract even larger numbers. They bask in the glory of administration from their followers. In times of disaster, they will make a point of showing up at the scene and more often than not are subject to criticism that they rush to cash in on political capital. Politicians, leaders who have many a time been accused of putting their interests ahead of the people. This age-old trait that has been carried into the pandemic situation with Kenyans, right from he who is in the highest office expecting change of heart, acts and tact. But the political space only slowed down then resumed, in some areas more than others. In Western Kenya, you will be pardoned for thinking an election is due in a year's time. Devolution Cabinet Secretary Eugene Wamalwa and Council of Governors Chair Wycliffe Oparanya have been leading Western Kenya troops in political forums while violating the COVID-19 guidelines, such as exceeding the number of persons supposed to gather, proper wearing of masks and social distancing. Amani National Congress Party leader Musalia Mudavadi and Bungoma Senator Moses Wetangula's team have also been on the political tour. The same applies for Kakamega Senator Cleophas Malala, alongside ODM Secretary General Edwin Sifuna, whose team has also been on the campaign trail. These have been creating platforms for the disease to spread, and more so to their followers, many of whom are low-income earners. The meetings, which are more of political leadership and for the ultimate benefit of the leaders, have heavy political undertones, despite some being branded as engagements on charting the way forward on the pandemic war.
We have unfortunately lost 3 of our frontline health workers and a university don in this part.
Nataka serikali iendelee kusaidia wananchi, kuwapa all the necessary protective equipment ili waweze kujikinga na hii ugonjwa ya corona.
What is unsettling for many Kenyans is that there are no repercussions, while less privileged Kenyans who commit even smaller sins are subjected to punishment, some of which ended in death.
Wakati ule ambao tunatangaziwa na Minister wa Health ya kwamba lazima tufuate sheria kuzuia huu ugonjwa wa corona kusambaa, naona ndugu zetu ambao ni wanasiasa wanaendelea kudharau hayo maagizo na kuendelea kutembea nchi mzima.
NTV's Zakas Mwasame reporting there. And it's not just the politicians with the bad manners, is it, Okusa?
Not at all, Smithy. Even the common wananchi have peculiar habits, most of which are clothed in impunity, and these are also taking a toll on the war against COVID-19.
A drive on the wrong side of the road and on the wrong side of the law. Floods in the city owing to clogged drainage systems, which in turn are due to integrity going down the drain. The source, people throwing their trash onto public spaces as opposed to designated areas. The examples can be numerous, but the principle is singular. Call it indiscipline, disobedience, or plain defiance. And now, the same attitude has locked arms with disbelief in the reality of the COVID-19 pandemic, and by extension, flouting the rules as long as you can get away with it. Reinhard Bonke, a resident here in Kisumu, does not ascribe to the gospel of stay home, stay safe, and wear your mask properly. He is one to evangelize the mantra, seeing is believing.
Mimi tangu COVID ianze, sijaiona ni nani amekuwa na hiyo. Hawajai niambia ni Mwangi, Omondi, ama ni mimi Bonke niko na corona.
But some of his colleagues in the boda taxi business think that what is being interpreted as indiscipline is in fact forgetfulness, and in some cases plainly put, impunity.
Kutotii ni kupuuza. Yeah. Na kuna ile kweli unaweza chikuta mko mahali na umesahau ya kuwa kweli kuna ugonjwa ama kuna kitu fulani.
Is a new thing we are trying to get used to. Yes, it is uncomfortable, but we can say desperate times call for desperate measure.
The issues that bedeviled different sectors or aspects of the Kenyan society before the pandemic struck are now making it even more difficult to battle the monster.
Polisi wengi pia wanakulia hapa. Yeah. So mimi sitaki kutoa pesa nipatia polisi each and every time. So nikuvaa tu kitu.
What has been referred to as Kenyans' bad habits is a key one. Many will follow rules not because of what the rules seek to achieve, but to avoid the repercussions. They will flout them if they're an inconvenience or will not get them what they want. They argue that the end justifies the means, which means that morality, uprightness, and the best interests of all are disposable.
The authorities themselves need to lead by example.
Some say this is in Kenyans' DNA. Ironically, a medical reference on what is making the medical war tougher, as the community transmission of the coronavirus disease is made easier by the laxity and approach by many Kenyans while treating it casually, despite repeated calls by government and medics. The rising numbers of the people who have tested COVID-19 positive are partly attributed to the, quote, usual Kenyan way of doing things.
Well, all said and done, a lot of these things boil down to money and the planning around it. Alex Mwangi, being a business journalist, from your interactions with some of these experts, what do you think could have been done differently to make life easier during these tough times?
Yes, Okusa, there's more that could have been done. Many economies have been pushed to their knees with massive layoffs and stimulus packages being the order of the day. Question now is, what do policymakers in government need to take into account going forward to avoid the hard-hitting blow of a pandemic?
On the fiscal side, how do you think governments can prepare better for pandemics?
Really, the question is, do we have a contingency fund? Can we have a contingency fund? Because nobody knows when you'll have a pandemic or you'll have a national disaster that requires use of these funds.
Almost 2 months ago, President Uhuru Kenyatta announced the initial 53.7 billion shilling stimulus package to tackle the COVID-19 pandemic.
Judging by the size of our economy, what's your take on the current level of the stimulus package that has been provided by the government so far?
If you have to look at the tax incentives that were given sometime in April this year, the World Bank has suggested that government is going to be foregoing about 140 billion shillings or thereabouts. So if you combine the two of them, 200 billion shillings worth of stimulus, that starts being significant. However, when you look at it broadly, comparing it globally, you think about the US having a stimulus of 15% of the GDP, then it starts telling you that Kenya's is still not as much as would have wanted it to be.
For the sustenance of financing the economy, Kenya, like many other nations, is hooked to borrowing, both domestic and foreign. The country currently spends over half of its revenue servicing debt.
We can actually not borrow ourselves into prosperity, but just borrowing without redirecting that money into private enterprise, into the agricultural sector, into tourism, to reopen all the tourism that has enterprises that have shut down is actually not going to be helpful to us as a country.
What's your estimate of the amount of money that we lose to corruption annually?
About 4 years ago, the estimates were about 1/3 of our budget. So if you had to put that into context, and assuming those numbers are still accurate, you're talking about a third of a 3 trillion budget. That's about 1 trillion shillings. So without a doubt, if we were to plug in these holes from corruption, without a doubt, this country would jump into middle income status tomorrow.
Do you think the amount of money that we lose to corruption annually is sufficient to cater for the pandemic's expenses?
If we were to channel those funds to the disaster preparedness fund we talked about, to addressing pandemics, we'd certainly be in a much better place as a country.
Many promises, plans, and proposals. Now it is a case of put your money where your mouth is. Smriti?
All right, Alex, thanks very much. And thanks to the entire team who participated in Team Coverage Wednesday. Join the